Welcome to Learn at Work podcast, which is sponsored by iOS Press, the publisher of Work, a journal of prevention, assessment, and rehabilitation. We're delighted to host this podcast that will bring together insightful conversations and thought-provoking discussions on topics that matter most in the realm of health, rehabilitation, work, prevention, and assessment. What can you expect from our podcast? We'll have expert interviews, individuals who have published in the journal, and we'll dive into conversations with leaders who have shared their valuable experience and expertise. You'll learn about different latest work trends, technology, and best practices. I'm Karen Jacobs, the founding editor of Work, and I'm the moderator of these podcasts. Welcome to this episode of Learn at Work. I'm delighted to have Jen Phillips on a very snowy day in Boston as our guest. And Jen, you have been an editorial board member of Work for 7 years, and I want to thank you. So let's start out. Where are you? Let's have you talk about your career, and we'll talk about your role on the Work Journal, as well as, what are you doing now and what are your scholarly interests? I gave you a lot to think about. So wherever you want to start will be great.
Well, it sounds great, Karen. Thank you so much for having me on the Learn at Work podcast. I'm very excited to be here. And yes, I have been an editorial board member for the past 7 years, and I have really enjoyed it. It's been fun to learn about the different research and just see what other scholars are doing within their work. My career has primarily focused on obesity and bariatric care, and I primarily work with adults in the home care setting. I also have been teaching at Boston University's post-professional OTD program for the past 6 years, as well as being an academic mentor and teaching for the undergraduate program at Boston University as well in behavior and health. I've also spent some time with the Interprofessional Leadership Certificate at BU, and that has been a really rewarding and great experience as well.
Jen, you've done a lot as a Boston University terrier, so I thank you on behalf of Boston University too, and iOS Press, which is the publisher of Work. You've spent a lot of time developing your skills and knowledge in obesity. And I think this is a topic that is important for all of us, not just healthcare, but people in general to really understand. So perhaps you can share with us some of the stigma, some of the issues, and if you can tie it into someone being a worker or the employer, that would be great.
Absolutely. Yeah, so when I initially started my studies at BU, I was focusing on obesity and bariatric care, but I really took particular interest in weight stigma and weight bias. I felt like I witnessed that being an occupational therapist in the field and seeing how patients might be treated at times. So, obesity in the world is just on the rise. Nationally, 41.9% of adults have obesity in the US, and that number is going to continue to rise. And with that comes weight stigma, and weight stigma is really experienced within healthcare settings and within the general public. Um, so weight bias and weight stigma are related. Weight bias is more judging a person on their weight and having preconceived conceptions of them, such as a stereotype, maybe being lazy as a stereotype and associating that. And then weight stigma is really stigmatizing an individual, especially in healthcare, for their weight and having alternative treatment options, not having the same access to the same equipment, and really not getting the proper healthcare that they should be getting. Research has documented that clinicians and physicians spend less time with clients that have obesity, and this really affects their care and their want or ability to attend healthcare appointments in general. So we're really putting this population at risk and not making them feel accommodated for in the healthcare environment.
So, Jen, this is, a very, very important topic. Is there something that all of us can be doing, be more aware of, to address some of this, the stigma and the issues?
Absolutely. Yeah. So the research hasn't had a definitive treatment for this yet in terms of something that was successful in trainings. But one thing, first off, is that you should be using people first language. So instead of saying an obese patient, you should say a client with obesity. Some studies even suggested that the term higher weight was a preferred term instead of obesity in general. Um, you can also treat the individual as a whole person and not blame their weight for what they might be going through within healthcare. For example, you don't want to blame things on their weight. You want to look at everything that could be a possibility. Other strategies include empathy, empathetic approaches, putting yourself in the person's shoes, and also making sure that there's a proper equipment available. I'll give you an example. When I was in the field a while ago, prior to this research, I was working on a co-treat and I was working with a client, and we were going to take a set of vitals. And my colleague did not have a bariatric blood pressure cuff. And my colleague in front of the patient said, I don't think this is going to fit. And the patient, was upset by this comment. I was upset by this comment too. I ended up taking a radial blood pressure, which is a blood pressure around the wrist instead. And that was accommodating. So making sure you have the proper equipment before you go see a patient or before you do a transfer so that the patient feels comfortable as well.
Jen, these are really good examples in healthcare. What about in the workplace in particular? Um, coworkers, supervisors, the worker themselves.
Yeah. So in terms of like team trainings within the workplace, I think it's really important to bring this to the attention of people who are in charge of those trainings. I think more weight stigma and weight bias trainings need to be implemented. I also think that obesity has been documented to be affected by employment. Studies have shared that people who have obesity don't have the same chances of getting employment, certain types of employment, compared to people who do not have obesity. So, keeping that in mind as well. And just keeping an inclusive environment, making sure everybody feels welcome and not making it about weight.
These are really important concepts to keep in mind. And you have a paper coming out in work, I think maybe, in the next couple of months, that's going to be addressing some of the topics that you just shared. Is there anything that we missed from what you're including in your sounding board article?
Yes, thank you. I'm very excited for my sounding board article to come out in the next few issues. So that's going to be called Weight Bias and Weight Stigma. What are we doing about it? So other strategies that were included in that article also talked about poor access to healthcare and how if we don't make a change now, then it's likely that people who have obesity, they're not going to feel comfortable going to healthcare environments. And with obesity projected to rise, people are going to have healthcare related problems, and we're going to see an influx likely of hospitalizations of people with obesity. So if we don't prepare for this now and make a change within the healthcare environment, I think that there's going to be attacks on the healthcare system, and these changes need to be made now. So unfortunately, the stigma and bias is so ingrained in our culture. Some studies have suggested this, that it's been found that it's hard to find interventions that are going to really make an impact on weight stigma and bias. So I think the important thing is really trying to find a solution for this and trying to see what is effective in changing this weight bias and stigma so that there can be a documented change in healthcare.
Jen, are you, thank you for that. Are you thinking about conducting another research project or, a systematic review of this in the literature? What's sort of your next direction in this topic before we go on to you sharing what it's been like to be an editorial board member?
Yes, I am currently working on a systematic review of weight, stigma, and bias in healthcare and its outcomes on patients. So, how they're affected from this weight bias and stigma. Various studies have shared that it's detrimental to their health, reporting varying eating disorders that arise from stigma in healthcare, as well as noncompliance and lack of motivation on taking a healthcare professional's opinion or suggestions. So I hope to complete that soon. And I'm very excited to formulate the information on that. And then I'd like to continue to see what intervention we can do to change the stigma associated and see what the best approach is. Right now, the literature has shared that in person interventions of just educational sessions aren't really quite enough, and that it really has to be combined with other approaches such as empathy and uh, and simulation tactics. So I'd like to look further into that to find an intervention that is successful.
Great. And I'll look forward to your systematic review and also, the next step in research that you're planning to do. So let's just transition to what it's like to be an editorial board member. You've been on the board for 7 years. You mentioned, how enjoyable it is to read other people's papers. But what is sort of the essence of what you, I think, feel about this kind of role?
Yeah, well, I feel so fortunate to be a part of this. I think it's an important role coming from both sides, so from publishing as well as reviewing, and having each sides be accountable. Um, and I've enjoyed the process of providing feedback to the authors after reading their work. I also feel like there's so many new and innovative uh, research articles out there that I've had the pleasure of reviewing first and learning more about. So it's definitely quite the process. I've been on the opposite end of having an article go through the publishing process. So I feel like I can relate to the authors submitting their manuscripts. But I'm just happy that I could be a part of that process as well and provide the feedback before it goes to press.
Yeah, we all know what it's like to be on the opposite side, and it's not easy to be waiting for feedback. It can be, a long duration sometimes, depending on the journal, and many different stages of that, publication process. So I think what you are experienced firsthand, and sort of the kindness that goes into providing feedback, constructive feedback, I think is invaluable.
Yes, I agree.
So, Jen, we're almost out of time. And I love ending some of these podcast episodes with, what's your why? What gets you up in the morning? What keeps you going? What is your why?
I love that question. I think my why in relation to this and weight bias and stigma and why I've become so passionate about it is because I really believe in accessibility and everybody having the right to equitable healthcare. And I feel like weight bias and stigma really is an area that hasn't been talked about that much, and it really needs to be spoken about. So I really want to try to initiate that change and make everything more accommodating and accessible, especially since the reality is that most of the population at some point will have obesity. So we need to have adults and children and parents and family members and caregivers feeling more comfortable in this environment. So I think that's my why. I really want to see a change, and I really want to be a part of it.
Great, Jen, and you are already, and I hope our listeners will read your sounding board article, which I think will be very informative for them, and strategies that they can apply to their own lives as well. So, Jen, thank you so much for being on Learn at Work.
Thank you.